Hello, my internet lovelies. I am Melissa, and I'm here to talk to you a little bit about nursing, the profession that I'm in. Um, there was an interesting podcast on Freakonomics recently that had to do with advanced practice nurses and physician assistants and their role in the future of healthcare and who's going to take care of us. Because I think most people have heard there's a physician shortage that we're looking at in the future. Among other things to worry about, there's another one. So I do want to talk to you about that, but I thought as a primer, as a beginner, I'd like to talk to you about what the different roles of nurses are, because it is terribly confusing, and even to people who have significant degrees in it. Oh, by the way, I wanted to show you. I've yet to show anyone this. This is my first time opening my significant degree. Let me just prove my credentials to you. I know credentials are important. Look at that. Look at that. I went back to school. I got this piece of paper. And I rolled up this piece of paper and I put it in the back of my closet, which is where it's going to go back to and be unchanging, just like the balance on my student loans. So, I am your official master's degree registered nurse. So let's get into it, okay? I'm going to go by level of education and then credential that goes with level education. There's a little bit of a it crosses over a little bit, so hang with me. The lowest level of education a nurse can have is an associate's degree. These are the nurses that go to community college. The program typically says that it's 2 years. Usually nurses spend about 3 years because the classes are difficult and they tend to be spread out a little bit more in order to get all of the clinical hours in required. So at the end of your community college experience, 2 years, 3 years, 4 years, you sit for the registered nurse licensing exam. And that is the license that you have when you go to get a job at a hospital, nursing home, home health agency. More and more ADN, associate degree nurses, as they're called, tend to have jobs in nursing homes, home health, less and less in hospitals as hospitals work towards getting nurses that have at least a bachelor's degree as their background education. So bachelor's degree nurses, these are called BSNs, Bachelors in the Science of Nursing. They typically go to school at a 4-year university or an online 4-year university, whatever. I mean, I can't tell you what that means. I don't think anyone can really tell you what that means. Some of them are definitely really good. Some of them are not as good as the others, but a 4-year university. And at the culmination of their clinical hours and education, they sit for the exact same exam as the associate's degree nurses. So they would get a registered nursing license, registered nurse. Ooh. And registered nurse is what I have. So I'm kind of weird. I have a master's degree in nursing and an RN, a registered nursing license. Education, master's degree, license, registered nurse. So the thing that I want to talk about, I'm not going to get to in the weeds here because we could get in the weeds. The thing that I want to talk about more is the advanced practice registered nurse. Advanced practice registered nurses are nurses that go through additional education at the master's degree level. They do additional clinical hours, additional pharmacology, additional pathophysiology, and they become sort of specialists with the once they get their license, they can prescribe medication. And that's one of the biggest differentiators between a registered nurse and an advanced practice registered nurse. Under the APRN, Advanced Practice Registered Nurse umbrella, are nurse practitioners, or NPs, which you commonly find in doctors' offices, more and more in hospitals as well, all over the place. Also, you will see nurse midwives, certified nurse midwives, wound care specialists, psych nurse practitioners. Great. It's a great role, and that is eventually what I want to talk to you about. But just to finish up this little piece, keep it short, the two highfalutin degrees that you can get in nursing are the Doctor of Nursing Practice, DNP, and the PhD in Nursing. Doctors of Nursing Practice, terminal degree. You can be a professor after that. The focus is more on clinical care. So if you're a DNP, you are more likely to do more patient care and less research, although you may well be a professor as well. You may be tenured. It's just sort of got more of a bend towards clinical care. PhD nurses are just like any other area of study. They are experts with terminal degrees in nursing, and they do a lot of research in the process of getting a PhD, and then after PhD are expected to continue with their research within the field of nursing. A lot of them remain in academia. And I think that's about it for the alphabet soup of nursing. And next time I'd like to talk to you about APRNs and how they are helping us out in primary care, in hospital care, and beyond, as we see shortage in physicians and as more and more obligations are put on the backs of our caregivers. Okay? It's been a pleasure meeting you.